Uterine cancer is cancer of the uterus, which some might call the womb. There are two types of uterine cancer, and these include cancer of the lining of the uterus, that's called endometrial cancer. And then there's cancer of, if you will, the muscle of the uterus, and that would be called a sarcoma. Postmenopausal bleeding is the hallmark symptom of endometrial cancer, and it's really important to know that bleeding after menopause is never normal. Symptoms of endometrial cancer before menopause would be heavy bleeding or bleeding between periods. With the sarcomas, you may have bleeding or you may have symptoms similar to fibroids, sort of like mass symptoms in your pelvis. Endometrial cancers are associated with hormonal imbalances, specifically the most common kind of endometrial cancers. And they're basically caused by having more estrogen relative to progesterone. Some of the risk factors for endometrial cancer include obesity, never having had children, taking estrogen without enough progesterone, or taking unopposed estrogen, just estrogen alone, taking tamoxifen, which people take for breast cancer. Additionally, there are genes that predispose you to endometrial cancer. These are genes associated with Lynch syndrome mainly. Those are some of the main risk factors for endometrial cancer. Uterine cancer can be prevented with birth control pills and by hysterectomy. It can also be prevented by IUDs with progesterone. There are several treatment options for endometrial cancer. These include surgery, there can be hormonal treatment, there can be chemotherapy, there can be immunotherapy, there can be targeted treatments. We have a lot of different treatments, and there's been a lot of progress in this area. Everyone with cancer is different and requires a different treatment plan. Here at Mount Sinai, we have experienced specialists and a multidisciplinary team, and we all work together to provide the very best care for our patients.